Welcome back. I am joined by a friend, Chris Hamilton. He is a employee benefits broker, and today we're going to talk about something that haven't really hit much on, and that is health insurance. Really going to hit on two things from the business owner's perspective, and then how to be smarter consumers of health insurance just in general. It's one of the biggest costs in retirement as well as in your working years. So, Chris, welcome.
Hey, Matt, thanks for having me.
Yeah, I guess kick things off just with the state of the market. Everybody's used to health insurance going up just about every year. That hasn't slowed down very much. It doesn't seem like, but just wanted to kind of get the lay of the land, and then we'll dig in from there.
Yeah, absolutely. Well, 2025 was a pretty difficult year for most mid-sized employers. It was one of the highest rate increase years that we've seen probably in the last 15, 20 years.
Wow.
It was not uncommon to see mid-sized employers, if they're in a traditional fully insured type plan, a bad renewal in years past might have been 15, 20%. But just from what we were seeing with clients of ours that were fully insured and just talking to other brokers around the country, it was not uncommon to see 30, 40, 50. I think the highest I heard actually a couple of weeks ago was 100% increase. So it just seemed the average renewal increase was much higher than what we've experienced in years past.
Yeah, what is driving that? I mean, healthcare's been expensive for many years, but like, is it the GLP-1s or is it just uh, what's the primary drivers of a 30 to 100% increase outside of the overall structure and how the plan is set up?
Yeah, we could talk, and I create a lot of content online just discussing these very issues, but this would be an hours long, days long conversation if we really got into the nitty gritty. But what I would tell you
Yeah.
that we're seeing is insurers are telling the market that they're having to pay more for health claims costs. And it's a combination of just overall usage of healthcare, but also the rising costs of healthcare. And there's a couple things that I would attribute that to. If you just look at an insurance company, most of us think insurance companies have incentive to help us lower costs, but they're purely just middlemen. We're all paying for our healthcare claims, and we're paying a carrier to pay for those. And the higher our claims cost goes, the insurance company is going to have to charge us for that plus their margin. If you look at how most of the traditional insurance companies are making money, they're not just health insurance, they're healthcare providers. They're in the ecosystem as well. So insert the name of your big insurance company. They also own their own PBM, which
Yeah.
is where they're collecting rebates. They take spread pricing. So they're marking the cost of medications up, charging themselves more than they should. And they're passing those costs on to employers and those employees, which is often you hear the question off I get all the time is like, why is it cheaper if I don't use my insurance when I buy prescriptions? Well, that's one reason. The other thing that most people don't think about is the rising cost of care in hospital settings. And if you just look at the average plan, probably 60 to 70% of the plan's costs are going to be tied up, or of claims costs are going to be tied up in hospitals. And why that's important, hospitals are the most expensive site for care. It's a lot more expensive than going to a doctor's office, right? Just, it makes sense. But one of the things that was happening during COVID was, I mean, we have a provider and nursing shortage. There's a war for talent going on. A lot of that staff was burned out during COVID. A lot of people left the industry. The
Hmm.
rising labor costs is driving rising healthcare costs as one component of it. But hospitals are having to raise prices to the insurers in their network agreements, and that cost is being passed on to employers. They usually sign multi-year agreements, right? COVID was in 2020. We're 2025, 26 now. A lot of those agreements are coming through to be renegotiated, and hospitals are demanding more from insurers. One of the other things I don't think is talked about much at all is the way our government contracts for care, or doesn't contract, the way they pay for care through Medicare and Medicaid. It's a much lower reimbursement than what traditional insurance pays. Oftentimes, you insert the name of a carrier, that the one that's on your ID card is typically paying two and a half, three and a half, sometimes 10 times what Medicare will pay for a procedure. And if you're a hospital, you can't negotiate with the government. The government dictates the price they're going to pay. Meanwhile, operating costs inside of the hospital business are going up 8 to 10% a year. Your reimbursements from the government, which in many cases is 50% of your revenue, is only going up 1 to 3%. Margin compresses, it inverts at some point. You can't negotiate with the government. So who do you negotiate with? It's the commercial payers, which we often think of as the insurance company. But at the end of the day, the insurance company is simply a middleman. Whether you're in a traditional fully insured plan or you're in a self-funded plan, the carrier is going to charge you for your claims.
Yeah.
So all this combined together, right? The hospitals are now demanding higher prices from the insurance companies. The insurance companies have to contract with those hospitals for the most part. Think about the big insurance company. They trade on having all these hospitals in network. We've got the biggest network. That means everybody's in the network, right? Imagine the hospital behind me, literally right behind me, dropping out of network with one of the big insurance carriers. What are the employers here in this market going to do? They're going to look for a different insurance company that has their hospital that they want in network. The insurance company realizes that. So ultimately, at the end of the day, the insurance company knows we've got to pay the piper to get them in our network. And ultimately, we're all going to pay for that in the form of rising healthcare claims. Rising healthcare claims translates to rising health insurance premiums. So, I mean, that's kind of a long way around the barn,
Yeah.
but those are, we often want to point to one
Yeah. It's not one
thing
thing.
that happens, right? But nothing happens in a vacuum. It's multifaceted what's driving costs.
Yeah, that's helpful to understand the state of the market and kind of how we got here. Looking forward, or like what can employers do, or what are you doing differently to help control those costs? Obviously, everybody acknowledges like healthcare is not going anywhere, so it's how do we manage that more appropriately and steer people to the best places to get care when it's appropriate.
Yeah, I think that's a great question, and that's the question that employers should be asking. We've been conditioned over the last several decades that the only way to do this for a mid-sized employer is you go to a broker who goes to one of the big insurance companies, and it just sort of is what it is. But most of the employers that we're working with today that are winning in today's market, they've taken a different approach. I highlighted just a minute ago that there are these hidden conflicts of interest within the big insurance companies. And if you run a business, if you're in a service industry, CPAs, banks, accounting, engineering, right? You don't manufacture a product. Your
Hmm.
biggest line item in your P&L is your labor costs. It's
Yeah,
your employee expense. But then generally the second largest expense is going to be your employee benefits.
yeah,
But if you think about the way we pay for things inside of our business, we never turn a blank check over to a disinterested or misaligned third party to go out and procure things on our behalf. But that's essentially what we're doing when you write the check every month to your fully insured carrier. So part of our practice is educating employers on how the insurance system and the healthcare system works. And ultimately, where we see a lot of our clients moving into is uh, not to get too far into the weeds, but they're moving out of that traditional fully insured market. There's two or three other models that we use to move them into a system where they can custom design their health plan to align the incentives of everybody that's part of the health insurance program. So when you think about networks, you can pick a network, but one of the people that's gotten a lot of notoriety recently, Mark Cuban, with his Mark Cuban Cost Plus drug program.
yeah,
There's huge savings compared to traditional insurance going through his program. But if you're inside of a traditional plan, you can't use his pharmacy. It's not a network, right? So it's how do
mm,
we include programs like that to where members can get their medications at a lower costs of procuring healthcare translates to lower health insurance premiums. So the employer wins, the employee wins, and everybody wins in that scenario. And I use prescription drugs as an example because that's something people use every single day. We know there's a big price difference, even at the same pharmacy. If you walked into the pharmacy and dropped your ID card, I dropped my ID card, buying the same medication, both of us are going to pay a different price. And if
yeah,
we use a discount card, it's going to be a different price. And the 10 people in line behind us buying the same medication, it's a different price. People understand that. But what most people don't understand is that pricing disparity, it literally exists in everything that we buy in healthcare, whether it's delivering a baby, getting a cancer infusion, getting an MRI. And so the goal that most employers have is, how do I design this benefit plan that helps employees get what they need, helps them pay the lowest price, and ultimately we as an employer are able to lower our costs, our employees are able to lower their costs. It creates a savings and sustainability over time. And that's
Yeah.
the goal that most of our employers have. Some of them want to reduce the cost immediately, and that's absolutely doable. But
Yeah.
what most employers want to avoid is the shock of a massive increase in any particular year. They want cost sustainability. They want predictability. And there are ways to design that into these health insurance programs, but most advisors aren't using them. So I think that's kind of the big point that I would make.
Yeah. Why are most people not doing it? I guess along those lines, like when you say mid-size employer, does that, what's your definition of like a mid-size? Do you have to be hundreds of employees, or is a mid-size 50 and above? What I think that would be helpful to better understand of who, what size you need to be to really make a program like this work.
We've seen it work for employers that are I would consider on the low end, probably 40-ish
Okay,
type,
that's all.
35, 40 employees on their health insurance plan is
Yeah,
typically where you can start unlocking some of these things. But we've got clients in multiple thousand life
okay.
employer sets that are doing this. I mean, you're
Mhm,
seeing it. You're seeing very large employers trying to tackle this issue. We've got clients that are in. I've got one that's in almost all 50 states. That's a little bit more difficult to tackle, but it's completely doable. And so I think the important thing for employers to understand is, let's look at the universe of options that are out there. And some of these may not fit your employee set, it may not fit your culture, it may not fit your geography, but let's pick the ones that we can to drive the change that we can, just not leave it all on the table for a carrier to monetize us. And
yeah,
that's really what we are. We are units of our companies. And look, Matt, I had to deal with this with our own company. We've got 200 employees scattered across the state of Texas.
mhm,
We were in this traditional model years ago, and we had to make this change ourselves. It's it's figuring out what are the things that we can do to start driving change and start taking that action. And that's our encouragement to employers. Some of them are ready to rip the Band-Aid off and just go off into the deep end and with cost controls and whatnot. But a lot of employers, what they really want is something that looks and feels like they've got today, but has these additional programs built in to help the company save money, help the employees. That's the big thing, is helping the average employee get what they need and help them pay less. That's
yeah.
the huge benefit of doing this the right way.
And I mean, we both have kids and utilize cooks and avid users of healthcare, if you will. I
Mhm.
feel like the way I'm consuming healthcare is not that different than 10 years ago, minus having kids. But how can we all be better consumers of uh, healthcare, if you will, outside of just getting on a program like that that has specific deals with specific providers? Is there anything else that low hanging fruit or things that employees are often missing, even high income earners, that just stupid decisions where we're just wasting money outside of negotiating for uh, prescriptions? Like I went to CVS and they told me this ointment was going to be $900. I told them I'm not paying that. She's like, let me see. She had a coupon and it was $15. Like, but that's kind of one off, I would say.
That's a pretty wild example.
Yeah.
And
And that
and
happened
it's
a few months ago.
well, yeah, not I had a not too dissimilar situation, and it's unfortunate that that's actually more common than you would think.
Yeah.
Right? And you made a statement, "I'm not paying that." You could also ask the question, "What other option do I have?" I think it's important to stratify this. Like, let's just talk about this from the standpoint, somebody doesn't want to move into one of these type of plans that I'm talking about. You're
Yeah.
talking about the average consumer, or if it's a business owner, somebody that's got means to pay for their health care, right?
Yeah.
What I do, and I'm not saying this is for everybody, but I use an HSA and a
Same.
high deductible health plan, and I have probably since 2009. I've been in it for many, many, many years. And I buy the highest deductible that I can in my plan. I've designed it that way. So a lot of employers are using these plans because it's one of the cheapest plans that you can get. And they use it to meet the minimum requirements of the Affordable Care Act. The problem that I see is that when you put that plan in place, the wrong people buy that plan. They buy that plan because it's the most affordable plan. It's the only one they can afford. They don't have $5,000 or $6,000 that they can pay out of pocket for their health care throughout the year, and they forego the care that they need, and it creates bigger problems in subsequent years. Excuse me. But for the right person that's using that plan and putting money away to pay for their health care, they can do what you just did. And at the pharmacy, look for, if you're not in one of our programs, you're just using a traditional insurance plan.
Yeah.
Is there a discount card at the pharmacy? Is there an alternative medication that I can use that has the same efficacy? Going in and getting MRIs or surgeries or minor procedures at a doctor's office, getting labs done, those sorts of things, is asking what's the cash price. And I've created a number of videos that have just gone viral on TikTok where I'm talking about the difference between insurance pricing and cash pricing. And the comments just blow up of people sharing their stories
Yeah.
of, my insurance was going to bill me, or it was going to cost $17,000 if I used my insurance, and I paid $1,700 when I paid cash, which is crazy. But
Yeah.
there's thousands of comments on these videos of people sharing stories just like that. So if I'm on an HSA plan and I typically am not going to hit my deductible and I need to have something minor done and I'm on a traditional fully insured plan, I'm just going to ask for a cash price and I'm going to pay for it out of the HSA account that I've got. I'm typically going to get a better price if I'm on a traditional compared to being on a traditional insurance plan. In Texas, interestingly enough, there's a law that if you're in a Texas-based plan and you pay cash for something and it's better than what the insurance pricing was going to be, you can submit that and get deductible credit. You can get out-of-pocket credit.
Oh, yeah.
Well,
So,
historically, we haven't been able to do that in
oh,
Texas, but
I did not
you
know
can
that.
do that now. And so that's the advice that I would give to a business owner that's, using an HSA that's got money set aside. For I mean, you pretty much anybody can do that, but going to the average employee, if you just think about inside of a typical company, I'm just going to kind of use a blanket avatar here of the average employee making $40,000 to
Yeah.
$50,000 a year. They're on an HSA plan. They probably don't have the ability to do that, which is why I always go back to employers and ask the question, doesn't it make sense to set something up that your employees can use if they're going to be on the plan? Because I'll give you this alternative scenario, which we see play out, is you have this employee making $40,000 or $50,000 a year. They're on that $6,000 or $5,000 HSA plan. It's the only plan they can afford. When they need routine care or they've got some symptoms of something going on, they don't have, they're afraid. Do I go into urgent care? Do I go into the ER? Do I schedule an office visit with a
Yeah.
doctor? What's it going to cost? I'm not going to pay that, because paying for that doctor or that medicine is the difference between them being able to pay their rent, pay for food, keep their lights on. They forego that care, and down the road, whether it's that year, second year, or third year, by foregoing care, they now have a catastrophic event that they end up in an ER, or it's so bad that they ultimately do have to go in, and they set their deductible up or they're out of pocket on a payment plan with the hospital and incur a multi six-figure claim because of it. And so if you design these plans properly, you can give those members access to that care, reduce or eliminate their out-of-pocket costs, and address the issue at the time it presents itself. And it prevents the employer from ending up with a catastrophic claim down the road.
Yeah.
So, and the reason why this is important, and I always harp on this issue, is employees are only able to buy just, if you look at the Americans just at whole, about 50% of our population is buying health insurance through an employer. Okay, that's important to understand.
Yeah.
The only option that employees have when selecting their insurance is the choices that their employer gives them.
Mhm.
So really what this means is the employer really does have an important role in our society of being good stewards of setting these plans up properly to meet the needs of the people, but to control the cost as well.
Yeah.
And so if you do it right, you can provide the care that employees need, that average employee, right? Because they're not all executives, they're not all making six figures plus, able to pay for premiums and care when they need it. Let's design a plan that meets them where they are and that can keep costs sustainable over time. And for employers that are trying to solve that problem, these alternative models generally work well for them.
Okay. Yeah, that makes sense. Uh, I do have one other question that comes to mind often, especially given that we work with a lot of people that are 50, 60, about to retire. Especially, this is specifically for those that retire early, uh, and, before Medicare. So let's, hypothetically say you've
Mhm.
got a 60-year-old, they can't stay on the company plan. What are the best options? Is my understanding, correct me if I'm wrong, it's effectively the marketplace at this point. Utilize that for catastrophic coverage and
Mhm.
then pay cash. Ideally, somebody that has built up HSA money and or they have the means to. Obviously, if they're retiring early, they have savings and all of that. But uh, outside of that, like you see some small business owners or people that have rental properties set up their own plan for a husband and wife, but that's I would say 1 to 5% of people actually
Mhm.
do that. Uh, eh, am I missing anything there, or is there a better way to do it for somebody that's been on a corporate plan their entire life? They have just a couple year window. Maybe both spouses are same age. What do you think there?
Yeah, I won't say it's better, but I'll say there are alternatives.
Yeah. Okay.
And it is one alternative I'd recommend for just anybody in that situation is one option is to get a marketplace plan, buy the highest deductible and out of pocket
Yeah.
that you can to keep the premium low, and then pair it with um, what's called direct primary care or concierge medicine. That's the
Yeah.
concept is that there are physicians that have just gotten burned out in the traditional practice of medicine, herding people through like cattle, see as many patients as you can in a day and bill
Yeah.
the insurance companies and just get what you can. And they're moving and transitioning into these models where it's a subscription base. You pay a monthly
Yeah.
fee to have unlimited access to these doctors, and they actually treat root cause of medicine, and they're actually able to practice medicine. So your annual checkup isn't 10 minutes with a doctor, you're good, move on. It's you're actually spending quality time with your doctor. Um, they're available to you 7 days a week if needed, virtually or in person. But the important thing that they're able to provide is navigation through our system. The
Yeah.
healthcare is really complex. The pricing is complex. Oftentimes, many of these providers have arrangements with other providers and facilities in the market where you can get cash based pricing. So if it's minor things, you can use them for that. I kind of view mine as a healthcare Sherpa. So when I need labs, she's coordinating that and I'm getting a much better price than using traditional insurance.
Hmm.
And I'm using the insurance purely for catastrophic situations. I'm in a car accident, I have a heart attack, I get cancer, something that's going to be catastrophic. An alternative to the traditional marketplace plan is going to be health sharing plans.
Yeah.
So there's a number of them out there if you Google them. Some of them are religious based, some of
Yeah,
them are
I've
not.
seen a few people utilize those.
Yeah, it doesn't necessarily work like traditional insurance, but it does
Mhm.
provide some level
Some
of protection.
protection.
But I would also pair that with a direct primary care physician.
Okay.
And there's those plans are heavily incented for cash-based payments of for procedures, even very big things. And they're typically going to be a fraction of the cost of a marketplace plan.
Yeah.
Now, there's differences in coverages between those sharing plans, but for all intents and purposes, several of them work very much like insurance. And if any of them hear me say that, they're going to like, it's not insurance. They always want to
Yeah.
caveat it. But for the way we use health insurance to pay for healthcare at work. Some of them work very similarly, but there's going to be limitations and exclusions to the types of things that they'll cover, like not going to cover a well visit, not going to cover maintenance medications. Typically not a big deal if you've got a direct primary care doctor. So those are probably the two biggest things that I would
Yeah.
recommend somebody to look at.
The direct primary care
Mhm.
concierge is a good complement to that strategy. All
Yeah.
right. Last question.
I'll just throw this out there real quick, Matt. If
Yeah.
somebody's interested in finding a DPC provider,
Yeah.
um, I can get this to you if you want to include it in the show notes. But I think the
Yeah.
site is
Please do.
DPC Frontier. If you just there's a website out there nationally that tracks DPC practices, and I can find the
Okay.
exact website. But if you Google DPC Frontier, it might pull up a DPC practice, but it'll also pull up the DPC Frontier map or DPC Frontier mapper. Uh, It'd be an easy way to find somebody
Okay.
that's local to you. But they're all over the country, and this is an area that we see growing exponentially every
Yeah.
single year.
Yeah.
And
I
in
remember
fact,
Brent Russell, I think was his name, the
yeah,
DPC here. I think he's at Optum now. But
yeah.
anyways,
Well, and Dr. Bricker's affiliated with
yeah,
one now. He's on a board of one, which is a
I
really good one that
remember
we work
him.
with. And we're actually seeing the convergence of these DPC plans being integrated into the health insurance group plans that we're offering to our employees, and to
Okay.
our employers are adopting these because they understand that it's hard for members to pay for routine care or emergent care or things of that nature. They just provide concierge doctors to all of their employees. And overall, employees get better care. It reduces total costs in the plan,
Yeah.
which reducing the cost of the plan reduces the cost of the insurance. It's just kind of this circular reference. So
Yeah, that's very helpful. I guess last question, looking into 2026 and beyond, like what, if anything, should business owners be considering that maybe we haven't already hit on, or just yeah, looking forward.
I think the two biggest things I would encourage a business owner to look at is alternatives to the four insurance companies you've been presented in years past. There are new entrants in the market. Some of them are pretty solid, some of them are pretty scary. And so I would say they need to evaluate those. They need to evaluate a plan structure like I talked about earlier. But the second piece of advice is find an advisor that's doing that, that
Hmm.
has experience. And I think one of the really important questions you can ask an insurance advisor or a broker is, what do you do for your own benefits? What does that look like? How do you manage
Yeah.
your plan? And if somebody's pitching you a new program, I would ask them, how long have you been doing it? And give me, how many clients are you doing it with, and what's their success rate with it? Because with new entrants into the market, that's a good thing. It's good and bad. Some of these entrants that are coming into the market with these interesting models, they're not going to be here in 3 years, five
Yeah.
years. We've seen collapse of some of these new entrants over the last 5 years. I think it's just really important to make sure you're vetting them out properly, working with an advisor that understands them and has used them and also has experience navigating their own benefit plan. Because we often think a broker's a broker, it's a commoditized service. It's just like a wealth advisor, just
Yeah.
like your CPA, just like your attorney.
Wildly different service models,
Wildly different
program.
expertise.
Yeah.
I mean, I'm not going to let my concierge doctor do brain surgery on me. I'm not going to
No.
let her do orthopedic surgery on me, right? Just like I'm not going to let a real estate attorney renegotiate my company agreement,
Yeah.
right? There's different levels of expertise and different specialties. It's important to find one that aligns with what you're trying to accomplish.
Yeah, a great place to end it. Appreciate you coming on, and we'll do it again soon.
Awesome. Thanks for having me, Matt.
Thanks.